There is a difference between men with pelvic pain during intercourse and women with pelvic pain during intercourse. A guy can still get an erection, still have ejaculation, be able to get someone pregnant if they hurt. There can be a vascular cause, especially for men, where there's just the circulation is not adequately being distributed and maintained in the penis. Or there's a twist in the spermatic cord, which hurts as bad as that sounds like it would. The guys tell me that. I don't have those parts, I can't describe it. But if you imagine watching any video where you see a guy get kicked in the testicles with a ball, all the guys in the room from halfway around the world will retract and protect themselves because they know that that's so tender. It hurts as much for women to have pain in their genitals as well. So there can be a vascular component, there can be some sort of twist or bend in a system that is like a fold in your sock, just isn't okay. There can be infection or tissue damage that can have caused a hypersensitivity in the area. Testicular pain, rectal pain, that golf ball in your rectum sensation, pain with ejaculation. Usually if it's pain while they're peeing, we talk about such things, then they see a urologist and make sure it's not a prostate issue. Non-bacterial prostatitis is a big thing. If your pain doesn't resolve to 1 round of antibiotics, 2 I think is what they're doing. Used to be guys would get put on 7 rounds. It wasn't a bacteria. It was a pelvic floor spasm or some other thing that needed care. So again, that goes back to if you're not getting better, this gets better. If the golf ball in your rectum is still there, if you're having sharp stabbing pain, if you can't sit, for gentlemen in particular, if you can't suddenly have an erection, you need to go see a doctor and make sure your heart's okay, because that could be a cardiac issue. That if a guy came in and said, wow, I used to be able to just get excited and get an erection, it was great, and now all of a sudden it can't, I would take their blood pressure, but I would also be saying you need to go see someone and make sure your heart's okay, because that can be an early warning of a cardiac problem. It's complicated, but the biggest thing is this gets better and people can just go back to a normal, pleasurable sex life. I think guys put up with it for less amount of time than women do.